what is a coronavirus?
Coronavirus is a large family of viruses that can infect animals and human. When it infects human, it causes mild respiratory symptoms, and sometimes it's severe. There is two outbreaks that happened before, one in China in 2003, it's called SARS, and the other one happened in Saudi Arabia and called MERS. These infections were very severe compared to what we have right now.
So what is COVID-19?
COVID-19 is coronavirus that's new. It's a novel virus and was started in China in December 2019.
What are the symptoms of COVID-19?
Symptoms starts with the mild symptoms of cough, dry cough, fever, and tiredness. These are the most common. Other symptoms can be aches and pains, respiratory symptoms like runny nose, sneezing, and sometimes diarrhea. Some patients will not have any symptoms, and although they have the virus, 80% of the patient will need no serious treatment. Only 1 of 6 patients will develop serious treatment, and this needs hospitalization and care.
So how does COVID-19 spread?
The spread is by 2 ways. One is through droplets when the patient sneezes or cough, and there's people around him, they will be able to inhale that droplets. And the other one is through surfaces. The virus will launch on the surfaces, and people touch the surfaces can get the infection if they touch their eyes or nose or mouth.
Thank you. What can I do to protect myself and prevent the spread of disease?
Yeah. The first thing is you need to call the local and national public health authorities to know if you live in an area that have the outbreak. Precautions can be first by washing your hands, which is very, very important. Staying away from any sick patient at least 3 feet. And make sure to wear a mask if you are caring for any patient that's sick. And use the respiratory hygiene, which is when you cough, you have to use your bent elbow, so you can cough through that if you don't have a tissue, so you don't spread the infection. And you have to contact the local public health authorities to know if there is any outbreak in that area that you are. Specifically, also if you're traveling, you have to check if there is any outbreak in that area that you're going there.
So how likely am I to catch COVID-19?
It's very low if you're living in the regular area where there is no infection, but it would be higher, especially if you have an outbreak in that area. So that's why you have to be always contacting the national and local public health authorities. And also, as a precaution, as we said before, that you need to be like 3 feet away from any sick patient who is coughing. Make sure you wash your hands, definitely.
So should I worry about COVID-19?
You can worry about that if you are living close to an area that has the outbreak. But as precautional activity, you should be away from patients who are sick.
What is that risk of developing severe illness?
The risk of developing severe illness is depending on the age and if the patients have any chronic medical problems. If you're elderly, you have higher risk of having severe illness, and if you have diabetes, hypertension, or heart disease, you have higher chance of getting severe illness.
So, are antibiotics effective in preventing or treating the COVID-19?
Antibiotics do not work on viruses, and especially on COVID-19. If you take antibiotics, you're not going to be helping to reduce the infection.
Is there a vaccine, drug, or treatment for COVID-19?
They are working on a vaccine right now. The estimation is around 12 months to 1.5 years, but still now there is no vaccine. and they're working on a treatment also against the virus. Still, we don't have any treatment or any vaccine at this moment.
So is COVID-19 the same as SARS?
It's from the same family. SARS is more deadly and less infectious, whereas COVID-19 is less deadly, but it transmitted much faster than SARS.
Good, good. So should I wear a mask to protect myself?
The only people who should wear a mask are the medical staff, the patient himself who is sick, and the caretaker of the patient who is sick.
How to put on, use, take off, and dispose of mask?
Okay, I can do the demonstration here. Okay. This is the face mask. First, you have to wash your hand before handling it.
Good.
Secondly, you should have the top of the mask is where you have the metal strip. And when you want to put it on, you have to put like that, and you have to squeeze on the metal strip so it will mold to be the shape of your nose. At the end, you should open it all the way so it will cover the mouth and the chin. And when you want to dispose it, you have to use your hands to take it from the elastic loop and not touch the mask, and then dispose it in a special area and then wash the hands after that.
Thank you so much. So how long is the incubation period of COVID-19?
The incubation period is the time when the patient gets the virus and the time the symptom starts. It is between 1 day and 14 days. The average incubation period is 5 days, but it can drag all the way to 14 days.
Good. So can humans become infected with COVID-19 from animal source?
The SARS had also the infection started in the civet cats, and MERS started from camels. But till now, we don't have any information about if there is any. They talk about the bats as the reservoir for the virus, but we don't know how they transmit it.
So can I catch COVID-19 from my pet, for example?
For now, no, especially cats and dogs. They don't have the virus so far.
Okay, so how long does the virus survive on surfaces?
It survives between a few hours to several days, depending upon the temperature, humidity, and the surface. That's why we don't have a specific time. It can be several days and or a few hours.
Good. So, is it safe to receive a package from any area where COVID-19 has been reported?
It is safe because the time that you get the package, there might be certain changes in the temperature and the humidity, and most of the time the virus dies before you get it. So for the time being, it's a low possibility to catch it.
Thank you. So finally, is there anything I should not do?
4 things. First, don't smoke. Secondly, don't use double masks. Thirdly, don't take antibiotic. And herbal remedies do not work. It's a specific problem.
Okay, so thank you so much, Doctor.
You're welcome.
Thank you.